It's a virus that can cause fever or neuroinvasive disease, such as encephalitis or meningitis. It's actually a vector-borne disease, so a mosquito will bite an infected bird. That mosquito can then bite you and inject the virus. About 1 in 5 people that are bitten by an infected mosquito will develop mild illness, and less than 1% of people will develop severe neuroinvasive illness, such as encephalitis or meningitis. The most susceptible populations would be the immunocompromised, such as cancer patients or people with other diseases that could weaken their immune system. Back in 2002, we saw the highest incidence of the disease. We saw a spike in 2004, and this is the highest incidence, the highest number of cases we've seen throughout the United States since 2004. Locally, we've only had 1 case, but we've had several pools test positive, indicating that there are mosquitoes carrying the virus in our region. The majority of people bitten by an infected mosquito will never develop any symptoms, and if they do, the symptoms will be mild. So it's very important to protect yourself.
We recommend, especially this time of year during mosquito season, in the peak biting times in the morning and in the evening, we recommend that people use DEET products to prevent any kind of biting activity on their arms, legs, any exposed skin. I also recommend they wear light colored clothing, long sleeves, long pants, just to protect those areas if at all possible. We also recommend that people look around their neighborhoods, look around their own yards, dunk or drain any standing bodies of water, which could be anywhere from a pool to an ornamental garden, trash can with water in it, just to protect the neighborhood or the community from any breeding sites for mosquitoes and to prevent West Nile virus. So at Hamilton County Public Health, we trap mosquitoes on an annual basis. The traps that we use are called gravid traps. The traps are set out in various parts of the county to capture mosquitoes to send to the state for testing on West Nile virus. We tend the traps approximately 2 to 3 times a week. The net for the mosquitoes, which they're captured in, is brought back to the office, put in the freezer to kill the mosquitoes, and then the sanitarian will count the mosquitoes and send them to the state in a vial. So then the state collects those mosquitoes, they go ahead and test them for any West Nile virus, and then they send us the results on a weekly basis.
To protect yourself, you need to wear mosquito repellent. If you can stay indoors during the early morning and evening times, you can prevent yourself from being bitten by a mosquito. If you have any stagnant water, remove those sources of stagnant water. And if you have any other concerns, call your health department.